Multiples are definitely on the rise, and it's mainly due to fertility treatments, and also their survival is higher, and that's just due to advances in medicine and neonatology.
While multiples born today have better outcomes, Laura, Allie, and Jana's pregnancies are still considered high risk, with a 60% chance of delivering early and babies averaging 5 to 5.5 pounds each. They are in good hands at Woman's.
Well, Woman's Hospital is really a unique place for care for mothers and babies. When you have a multiple, those babies are actually at very high risk. That's why it's important that they get appropriate care through the pregnancy, and they deliver in an institution that is able to take care of babies that are small and at high risk.
Once it became clear they were expecting triplets, Allie, Laura, and Jana immediately became patients of the Woman's Maternal Fetal Medicine Center, as well as their regular doctors.
Maternal fetal medicine at Woman's Hospital is a consulting practice. Our maternal fetal medicine specialists typically do not deliver babies. We develop a roadmap for the attending obstetrician gynecologist to help manage high-risk pregnancies. I think it's important for maternal fetal medicine to be involved because we have a set of skills that's outside general OBGYN. You get good in life by doing repetitions of things, and by virtue of our experience of taking care of many, many women with higher order multiples, we can be more attuned to the small things that go on from time to time. Granted, their general OBGYNs are very, very good, but it just gives another set of eyes to look at the patient to make sure any problems developed are managed appropriately and very quickly.
Woman's maternal fetal medicine physicians travel daily throughout Louisiana, helping women with at-risk pregnancies, and telemedicine plays a big role in their care.
Telemedicine is trying to get better use of our physicians when we don't have enough of them. If you live in a remote area and you have a patient there that has a high-risk problem, then a doctor many, many miles away can look at that patient through digital transmission of images.
Through a secure link, Woman's is able to transmit a live feed of Laura's ultrasound to Dr. Sandomal, bringing the physician to the bedside.
You tell Ms. Laura Kleber that everything looks grand, and I'll see her a little bit later on.
I loved seeing the babies and where they were and that they were okay. It was very comforting.
Another unique preparation that Woman's offers to all multiple moms-to-be is a personal hospital tour. We followed Laura and Craig, who were led by Angela Hammett, Woman's perinatal education coordinator.
I pick the patient up, usually after one of their maternal fetal medicine appointments, and I actually take them over to the Infomedics office. Infomedics is a group of 9 neonatologists that work here at Woman's Hospital, and they are the ones who actually take care of our premature babies. So this is a really neat experience for the parents to be able to sit down, have an appointment with a neonatologist when they're not in labor.
Laura and Craig then get the full hospital tour, including the antepartum unit for women on bed rest.
The antepartum department is a unit that is focused on high-risk moms who are admitted to the hospital, but not necessarily for labor and delivery. So these patients are brought in, they're monitored by highly trained nurses who take time with them to answer any questions that they have, and they're in close proximity to labor and delivery if for any reason delivery becomes imminent.
Triplets are delivered via cesarean section because they are often preterm, and it reduces risks to the mother and infants.
With all of the multiple deliveries performed here at Woman's Hospital, we have a team that goes to each of the deliveries, whether it's for twins, triplets, quadruplets. Each baby has their own team.
Next stop, the neonatal intensive care unit, where Laura and Craig will have full access to their babies.
Woman's practices a family-centered care model, and with that, it is very important for us to allow 24-hour visitation of parents to their babies in the NICU.
That's a comfort to Laura and Craig as they know their babies, along with Jana and Allie's, will probably spend some time in the NICU. Multiples often need a little extra monitoring when they are born due to low birth weight and possible complications. And at Woman's, they are prepared.